The man who helped eradicate one of the most lethal diseases in human history through the use of science has died. Dr. William Foege died on Saturday. He was 89 years old. He was a former director of the CDC in the 1970s and 1980s, and he is credited with using science to fight and beat smallpox. Joining us now to discuss is Dr. Céline Gounder, a CBS News medical contributor and editor-at-large for public health at KFF Health News. Céline, you sent me something that was incredibly moving yesterday about Dr. Foege. Just describe to our audience how critical his work was in eradicating smallpox, but what he meant to you personally.
Yeah, for centuries, smallpox was a fact of life. So you had a very contagious and disfiguring disease. Hundreds of millions of people died from smallpox. And I think what was so important about Dr. Foege was his understanding that a rigorous understanding of the science, a continuous reevaluation of the situation on the ground, combined with moral courage. So standing up to naysayers and political pressure to do the right thing, that's how we got rid of smallpox around the world. Foege went on to help expand childhood vaccinations around the world, saving millions of lives, and worked on everything from HIV/AIDS to chronic diseases. And I think what really stood out to me about Bill Foege was his humility. This was not a guy who was trying to get prizes. In fact, he left India shortly before the country was declared free of smallpox because he wanted his collaborators, the Indians on the ground, to get the credit.
Wow.
Foege also often spoke about the idea of being a good ancestor, and that was not about how you'll be remembered, it was about the world you leave behind.
I love that. Impact, such an important part of his work. I know you had a chance to speak to him in an interview, and you talked about humility there, but I feel like optimism is also something that was so inherently part of who he was. So let's take a listen to that clip.
There was a fellow by the name of Harlan Cleveland, who was an American diplomat. He was our ambassador to NATO for many years. And late in his life, he became interested in global health. And he was astonished at what happened with so few resources. And he came to the conclusion that global health workers are fueled on unwarranted optimism. And I like that phrase because that is, in fact, what we do is we become very optimistic and we make something happen that could not have been foreseen that it would happen.
So such powerful words there. Explain that phrase, unwarranted optimism.
So I think when he's talking about optimism here, this is a deliberate choice. This is not about having a sunny disposition. He's talking about having the moral imagination to imagine how things could be, how much better things could be, and to aspire to that. And Foege, as a mentor, often told me, bet on the optimists. I literally think about that advice every single day, especially since 2020. Pessimism means you've already given up. So choose optimism. And frankly, this applies to so many things in the world right now.
Can I just ask you, we actually said in the introduction that it was through his rigorous, and you said it too, his rigorous science-based approach that helped eradicate smallpox. People don't remember, we were talking during the commercial break, those of us of a certain age, I received the vaccine when I was a child. I was born in the 60s. We had family members who knew people who had smallpox, who died from smallpox. But before that, the World Health Organization, before Dr. Foege's approach to it, the World Health Organization was trying to mass vaccinate people, and that wasn't working. Why wasn't that working? And why did his approach, which was to find the outbreaks and then isolate the cases, how did that end up being the solution?
And I think it's important to note that this doesn't necessarily work for everything.
Yeah.
This would not work for COVID because COVID, the incubation period is shorter. Smallpox, it takes 2 weeks from the time of exposure to developing symptoms. So it is a unique disease in that sense. But it was a combination of things, not having enough vaccine to go around, but also realizing that they were vaccinating the same people over and over again and not getting to the pockets of people who were not vaccinated. So they focused their efforts on case finding these all India campaigns, for example, going door to door in urban areas, in rural areas, looking for cases, and then focusing vaccination in concentric circles around those cases.
Oh, that's
Very
really interesting.
Yeah.
Really, and it changed the world.
And it changed the world.
Yeah,
Yeah.
indeed. Dr. Céline Gounder, so good to have you here. Thank you very much.